All right, hey everybody. So it's been a while, but we are doing our next version of whatever we call this.
Video updates.
Video updates, yeah. And so today what we wanted to focus on is really talking about the importance of chiropractic care for the pediatric population or for young people really. And so if you've been a patient for even just a few weeks, few months, or definitely years, you might have kids that already come here, and so this will be good reinforcement for that. Or you've clearly seen kids get adjusted in our office, and might wonder, why is that child getting adjusted? Is it what's maybe either wrong with them, or like what is the purpose and like the thought process behind that? Um, or you might have a neighbor with kids that like this could benefit. So even if like that's not directly relevant to you, I think it's really kind of relevant to the people around you and the circles around you. And I know for me when I originally went to school, my thought process was, even though I had been adjusted as a teenager, like my first adjustment was a teenager, I originally went in because I had neck pain. So, even though I knew that young people could be adjusted because I was a patient as an adolescent myself, I never knew that there was sort of this preventative, and really wellness aspect of pediatric chiropractic. I didn't know that until I got to school or really started shadowing offices that had, large pediatric populations and started hearing and seeing, miracles and just transformations that, took place for that. So, how about for you? Like, what was kind of your introduction to pediatric chiropractic?
Probably through the ICPA, like just going to some of those seminars. I always knew that I wanted to like specialize in or do extra training in pediatrics and pregnancy. And so going to those seminars were really just like very eye-opening to see how much change you can get with children, especially compared to adults.
Right.
Not that you can't get like amazing changes with adults because we obviously see that every day, but kids, I mean, like one or two adjustments, their lives can sometimes be completely transformed. And hearing those testimonials and seeing like people would bring in their kids and like tell their stories, I'm like, oh my gosh, this is amazing. This is
Yeah.
exactly what I want to do.
Right. And I think, one of the traps that we as doctors, and I know especially when I first got out of school, I really thought that in order to convince parents that they should not only get adjusted for themselves but like bring their kids to us too, as I thought I had to just hammer them with like facts. And I almost fell into that trap again before, because we were recording this call. We thought, oh, we could print out the thousands of research articles that have been done on the benefits of chiropractic and for children. But the reality is that like facts kind of don't matter. I mean, we as human beings, we're not logical or even rational beings, really. We're emotional, beings. So the fact is that there are thousands of research articles showing the benefits of chiropractic care for children. I mean, reduced ear infections, improved immune system. Of course, there's the postural benefits. There's reaction times. They're just in general much more healthy, robust, and having like amazing lives. I've seen that with my kids. I mean, my wife, her dad was a chiropractor, so she was adjusted from birth, and she's never been on an antibiotic or a prescription medication in her entire life. I mean, she has like 50 plus cousins who all their parents or one of their parents was a chiropractor, and it's the exact same thing. And now and some of them, they're almost pushing on 50 themselves, and they've never been to a doctor for a medical reason ever in their entire life,
Like
other than
no
maybe,
eczema, no
right, exact allergies,
allergies, no
asthma, no
autism.
autism, and, other than maybe trauma or broken bones, which of course you're going to,
Yeah.
seek out that for that at that point, but you've never had to have a managed medical condition. And so for me, it's like, well, that's 100% what I want for my kids and my family. So it's like, I don't need to keep reading research articles about the importance of doing that. Like, I'm just going to keep adjusting my kids because I'm going to do everything that I possibly can to give them that vision and that future. Um, so, I kind of say that because, meaning like, if we were logical and rational beings, well, logically, if you think that chiropractic is good for you as an adult, well, then logically it would make sense that at least your child should be, evaluated. And again, I know some of this is, we're preaching to the choir here a little bit.
But sometimes it's good to just be reiterated. I mean,
Yeah,
this is why we go to church on Sundays, why we listen. Like, it's not
right,
like we don't understand the concept. It's
right.
because we need to hear these things over and over, and we do get golden nuggets from it that maybe we didn't pick up the first time.
Yeah.
So it is important.
I mean, it's
Even if
society.
you get your kid adjusted, you should still
Exactly.
come to this.
And why? Because, well, society is always going to try to pull you out of the things that they don't understand or, are countercultural, right? So counterculturally, like, bringing your child to a chiropractor, especially if they don't have major health issues, is very countercultural, right? But what's interesting is like that's not countercultural to bring your child to a dentist regularly even if they don't have dental problems, right? It's not countercultural to, even for the most case, to like give your children, vitamins or healthy food even if they're not obese or have, health problems. But for some reason, a lot of chiropractic, and I do feel like it's getting less over time, right? It's way less than what it used to be, but it's still like this unusual thing for the majority of people. And if some of you can probably, as you're watching this, agree, where it's like you tell your friend that or some of you might even be too embarrassed to tell your friends that you bring them to a chiropractor because you don't want to just deal with whatever judgment or questions might come with that. And I understand that. But when you actually think about it, what's more crazy is to do whatever you possibly can for your child to be as healthy as possible, right? Even if that is different than what the mainstream, does, or just choose to not do it because you think it would be weird or different, right? So let's go through some of the reasons that I've identified or we've identified over the, since we've been in practice on why people ultimately, even if they have been x-rayed themselves and they might have gone 50 years of their life or 40 years of their life, never had an x-ray. Now they're like, oh my gosh, like I wish I would have known this 30 or 40 years ago, right? And then here there's their kid sitting there and they've never had an x-ray, right? But let's go through the top reasons as why a parent wouldn't get their, kid at least checked, like not to mention care, but like at least checked and kind of go through some of those. So do you want to do the first one?
Yeah, probably. And one that we've had recently is people are like, my kid is too crazy. They're not going to sit through the exam, or they don't want to get up on the table. Another one is money. Obviously, we're living in a crazy world right now.
Mm-hmm.
And if people don't understand why health and chiropractic care should be a priority for your kid, of course, that's going to be something that kind of falls to the back burner.
Right.
They don't think their kid has a problem,
Mm-hmm.
especially when people are, bringing in infants or asking about infants. They're like, well, my baby was just born. How in the world is it going to have a health
Right.
problem?
Right.
But even the birth process, even if it's the most beautiful birth, it is really traumatic. You have a very big baby going through a very small canal, and there's a lot of twisting and turning that can happen, that perhaps isn't the best, maybe for the cranial bones or for the upper neck. And again, we talked about the research, but there is a lot of research out there saying that a kid that is born even vaginally or through C-section do have a lot of subluxation in that upper part of the neck, which we know can manifest as so many issues later in life. So why not go ahead and correct that?
Yep.
And then another big one is people who get adjusted like as an adult. They're like, well, sometimes I feel like my adjustment could be a little aggressive, or I don't really want to do that for my infant. But we adjust infants and kids completely different than we adjust an adult, because as an adult, our growth plates are solid. We have muscle patterns that we're fighting against. With infants and toddlers, we don't have that, right? So we literally use the amount of pressure that it would take to like check to see if a tomato is ripe.
Yeah.
And we everything that we do is very specific for that child, because we really want the best for them too. And we know that we want to make it as comfortable as possible because we want them to come back. We want them to love it.
Yeah. And I'll just chime in on a couple of those too. So, the whole my kid is too crazy. Well, I mean, sure. I mean, every parent thinks their kid is crazy. I mean, I have 3 of them, and I've always thought, it's like there's that little bit of like, embarrassment to think like, oh, well, like I don't want my kid to make a scene or whatever it is. But it's like, guess what? That does not stop you from bringing them to the dentist, because it's far easier to get them to lay on the table for 30 seconds here than sit in a dental chair for an hour, right? If they can do that, they can certainly lay on this table here. Second of all, we're super patient, and every single kid, I mean, I'm talking 15 years of practice now, that at one point might have been screaming bloody murder at the most severe case, right? To just shy or, pensive about it. Within a matter of visits, they usually start fighting, the kids will start fighting over like being seen first with
Mhm.
like their siblings, right? Because they love it so much. We have a private room. If it really comes down to that, we have the koala bear table where even if kids are a little bit uncertain about this, they are not uncertain about laying on a koala bear's face.
Mhm.
So it's
Just
just,
playing on the parent.
yeah, or laying on the parent like that always will calm them down. And we still have parents, kids that have been coming for years and they still choose to do that. And like, that's great. Like take that time to get extra oxytocin and dopamine and right and all that stuff. So it's just kind of like we get it, but it's kind of like a silly, just sort of excuse, right? And then in terms of money, I think obviously like we think about that, but arguably when you really again come down to it, again, kind of taking away from the rational and logical, it's like, yeah, we get that. But like, if there were ever to be a severe health problem arise, I don't know one parent on the planet that wouldn't do whatever it takes to find the money to pay for that. And granted, to pay for wellness chiropractic care for a child is, I mean, it's pennies on the dollar compared to expensive medical conditions in terms of like the bang for the buck on that. Most babies and kids are coming once a month and they do amazing. And that's all we need to do to make sure like we are guiding them to a much healthier and better future and one with a lot of prevention. So, and we give family discounts. So really that's why you'll frequently see like a family of five come in and they all get adjusted, and make that happen. So I don't think they have a problem. I mean, again, I get that, but that also it's like, well, you don't. That's you still get X-rays of your kids' teeth probably every couple of years, even if you don't think they have a problem too. So that one's kind of silly as well. And then yeah, I mean, you kind of handled the safety thing too there, but I always kind of to go to the extreme example is if we had ever in this office or any chiropractic office in our community had ever had um, like a major safety or injury to a child, I mean, it would be a career ender, right? I mean, like, you know what I mean? Like, imagine something bad happens to your child in a chiropractic office. I mean, that would be on every news station, front page of the newspaper, even though that stuff happens in the medical, hospitals every single day, right? But if it was in a chiropractic setting, that person would, I mean, it would just be a career ender. And so thinking in terms of like safety, it's like you would have heard something by now if that actually happened on any level of frequency, which it doesn't. In fact, it's safer to adjust kids than it is to adjust parents or older people. So, anyways, yeah. Anything you want to add to that?
I don't think so.
Okay. So, one just kind of final thing on this topic and just like thinking about this kind of issue of kids getting checked. I always am envious of orthodontists, and I think about how much orthodontists charge for straightening of teeth. I think about as a business owner, not even as a clinician, but as a business owner, I envy the simplicity of their sales process. Like your kids' teeth are crooked. They need braces. It's going to take 2 years and it's going to cost $6,000 or whatever it is. And oh, and by the way, I can already tell your middle is going to need it too, and probably your younger one as well. So just start planning for $18,000. And the vast majority of people don't even bat an eye at that. Even if they don't have the money, they find the way. They finance it, care credit, whatever it is, and they just do it without thinking twice. Well, why is that? I mean, if you think about it, if you have a kid that has braces, were you worried? Was your first thought about finding out that your kid had braces, were you worried that they were going to have health problems because of crooked teeth? No. What were you thinking about? You were thinking about how you didn't want your child to be self-conscious, to be the weird kid with the crooked, snaggly teeth, or whatever, hanging out of their mouth, and all the trauma, emotional trauma that would create, throughout their teenage years, right? But ultimately, it's like it doesn't have any negative effect, unless, of course, the severest case is on a person's health whatsoever. But let's think about the negative health effects of having, any type of misalignment in your spine. I mean, you got nervous system development problems. You have all the symptoms that can create, and arthritis, premature arthritis, and just damage there. And those do have serious health complications as well. So I really think, again, it kind of just goes back to we're not logical, we're not rational, we are emotional. So if that's you, then you need to emotionally think about whatever health challenges that you've had in your life. What would you pay or what would you give to be able to go back in time and have a plan of action to prevent these things from ever happening in the first place, right? Maybe you never wanted a sciatica, the diabetes, the arthritis that's in your spine. If you could go back in time and have a plan of action to prevent that, what would that be worth to, avoid, those things too? So, yeah, we don't want to beat a dead horse, but I think we probably have beat the
Yeah.
horse dead by now. So,
Well, too, just how he said, like, we're not rational, we're not logical, we are emotional. So in the spirit of that, we want to share some really amazing stories that have happened. Some of the ones I'm going to share literally happened in the past 2 months.
Mhm.
I've had a little girl who was completely nonverbal. She had a couple of words, and then through a series of things that happened, which we're not going to talk about on this video currently, she lost the ability to speak and has not spoken in 2 years. And then when she started getting adjusted and we were doing some supplementation, she actually said mama and has continued to say it. So that has been literally amazing. Whenever they came in and shared that with us, I literally was like, had tears. I was like, oh
Yeah.
my God, this is amazing. And then from a behavioral standpoint, we have had numerous kids come in. And I think because I am not a parent yet, I don't really understand until the parents sit down and share with me how difficult behavioral issues can be, not just for that child, not just for their schooling, but for the whole family, and how much attention it takes away from other kids or from your spouse. I mean, it is exhausting.
And I can tell you as a parent, if your child exhibits any type of behavioral issues, you feel like a failure as a parent, because it's like, man, did I do something wrong to not guide or help my child's behavior be better than what it is right now, right? And sure, maybe that is, I'm not a child psychologist, there could be some of that, but if you've done the best that you absolutely can, and your child still has those issues, it can be very defeating as a parent to experience that. So
Especially because in the medical community, I don't think there's much like it's dismissed, right?
yeah,
But in our world, that is behavioral issues are a huge sign of your nervous system is dysregulated, which
screaming for attention, right?
yes,
Yeah,
right. And so it's nice to hear like, oh, it's not something I'm doing. There is actually an issue here, and let's address it. And through adjustments, again, through some nutrition, some lifestyle changes, both of the kids that I'm thinking about, which I'm not going to say their name, but you know
yeah,
exactly what I'm talking about too, have had completely like, I mean, ended the school year with reports from their teachers that were like, whatever you're doing, please don't stop doing it
yeah,
because this is a completely different kid.
yeah,
And even the parents saying like, you don't know how nice it is that we can sit down at a dinner and we can all just eat together. I'm not chasing him around,
yeah,
trying to feed him. He's not throwing the fork. I'm not yelling at him. And then it's like dinner's done, the kids are gone, and the mom is just now sitting down, hasn't
right.
had a chance to speak with her other kids or talk with her husband. It's like it's just a completely different environment. And that's just one small aspect. So I can't imagine how like positively that's affecting the rest of their life.
Yeah. We've seen life-changing cases of horrible eczema clearing up. We have seen major digestive issues clear up. I mean, asthma. I have one young girl right now who is having issues with asthma, and mom was like, "Do I need to put her on an inhaler?" 2 adjustments, and her breathing is like almost completely fixed, right? Um, we have people. I have one case that, and well, multiple, but the most dramatic one was having a largely nonverbal, I think he was like 7 or 8 years old, autistic child, have his label reversed over the course of a year. So he literally they removed, this child is no longer exhibiting signs or symptoms or behavioral patterns of that consistent with an autistic child. So he went from autistic to not autistic from this stuff here. Scoliosis, he's corrected. I mean, we have one who had scoliosis, and it changed her life so much that she's now, I think she's finished her first year
Yeah,
of
in
chiropractic
chiropractic
school,
school.
which is so cool, to think about that.
And
You
that's one of
know,
the greatest gifts.
and we could, yeah, exactly. We could go on and on and on about that, but I will say that as much as I love transformational things happening in children, seeing those lives, and families literally like renewed, from their child getting healthy again, it's still, that for me does not hold a candle to the miracles that never had to happen, meaning that the children that were adjusted from birth, young ages, and just really done it, the parents did as much as they could at a young age to and therefore those conditions, never developed in the first place, because almost all of those are largely preventable, if not completely preventable too. So that's why you'll see babies getting adjusted. Well, so what's wrong with that baby? Maybe nothing. Maybe the baby, the parents, maybe it has a little acid reflux or sleeping, maybe, and it can help with that. But maybe it's the parents like, well, this makes sense for me to get adjusted to be healthy and well. Why would I not start this as early as possible, for my kid, too. So it really is a beautiful thing. Hopefully, if you're sitting here and you're like, I've never had my kid checked, but hopefully maybe it makes a little more sense, now to at least get them checked and then go from there. Or if you come across, really, I could argue with anybody that every single person should be checked, on planet Earth. Every single child, should be checked on planet Earth. But especially if, people are struggling, like this is potentially their way out of it. And, hopefully a path to health and wellness too. Any final thoughts you want to add?
You just want to tell them when the talk is?
Yeah, so we have Raising Healthy Families talk is happening on August 20th. That's a Tuesday. You can register at the front desk or online.
The link is in our bio on our Instagram and should be Facebook.
Yeah, and Facebook too. So it's a free talk, for you guys, for patients. We're going to be talking about, not only, some more factual things about chiropractic, tangible, but really, nutrition, supplementation, detoxification for kids. They are tiny humans, yes, but it's not always just as simple as like scaling everything down, weight wise, too, but also how to, boost their IQ. These are the things that I love to focus and spend my time on. And so we're going to talk about those things, how we give your child really the best, current, health and future health from that matter, as well. And then also for the entire month of August, any kid under the 18 years or younger that gets evaluated in our office, it's just going to be $40 for their full evaluation, no matter what we need to do. And we're actually going to donate that to a local, kids program here too. So, that's if you're a patient or not, or if you have like a kid's neighbor, family member, grandchild, whatever, to get checked. We're going to do that for all, pediatrics. So you can take advantage of that.
Yeah.
Awesome. All right, guys, take care.